During my residency in 2003 and 4, we started to do what's called deep brain stimulation. And so I learned to do the technique in 2003, and then I went back in 2007 and I did a fellowship or an extra year of training after residency to learn a lot more about that. And since then I've been doing it a lot more frequently. Deep brain stimulation, a lot of people describe it as a pacemaker for the brain. There are some similarities, but what it is with a heart pacemaker, you have a battery that's placed under the collarbone, and when the heart has an abnormal beat, the battery gives a pulse of electricity to restore the normal beat. With deep brain stimulation, what happens is we give a constant type of electricity, a very small energy level, to suppress abnormal activity in the brain. Deep brain stimulation was approved first in 1987 in Europe for the treatment of essential tremor. Later in the United States in 1997, the treatment was then approved for essential tremor here and also for tremor related to Parkinson's disease. In 2003, the FDA approved deep brain stimulation to a target called the subthalamic nucleus for the treatment of advanced Parkinson's disease. Additionally, there's a condition called dystonia, which is less frequent, but it can be effective for the treatment of that as well. There are two types of patients who really benefit significantly from deep brain stimulation. One is the patient with a condition called essential tremor, and we have a number of different medications that we use for this condition. Once the patient is failing treatment with those medications, then that's someone that we can help with surgery. The other type of patient that we can really help with deep brain stimulation is our patients with advanced Parkinson's disease. Most of our patients have had Parkinson's disease for at least 3 to 5 years, but oftentimes longer, even 7 to 10 years. And what happens over time is that the medications are effective for a while, for many years, but then they start to become less effective, where patients are still getting good relief of their symptoms, but they have to take more of the medication to get through their day. And those are patients that we can really help with deep brain stimulation. Looking into the future, there are conditions such as epilepsy, obesity, depression, and some people even think addiction that could potentially be treated with deep brain stimulation. In these cases, this is still very experimental and very much in the future, but this is the direction that this technology is going. The partnership between Area and Capital is unique. At Capital, our passion and our expertise is in neuroscience. All 30 of us, many of us were leaders in our field and still are in delivering the latest clinical innovations and new methods of treating patients. What Area brings is exceptional care to the community that it serves, and the two of us doing these things together, it's a great fit.